Hello, my name is Luis Argueso. I'm partner and co founder of In Health Advisors. We're a healthcare advisory firm that specializes in helping healthcare organizations develop successful strategies for provider alignment around value based care initiatives. We work with a whole host of organizations, including digital health companies. We're excited to present our video today to you on what every digital healthcare company should know about value based enterprises. We'll start our video out today with a bit of an introduction, covering some of the challenges and opportunities facing digital health firms today. We'll then transition to introducing the concept of the value based enterprise and previewing how it can solve some of those challenges. We'll then detail why value based enterprises are well suited for digital health companies. And we'll conclude with a couple of examples of how these value based enterprises could be applied to digital health firms and their strategies for growing their business, particularly around value based care. Let's dive right in. Starting with the theme of challenges and opportunities faced by digital healthcare companies, let's begin with talking about the current macroeconomic environment. When we look at things like fiscal sustainability of programs like Medicare, there are a lot of questions in place as to whether the current spending trajectory is sustainable. For example, the Medicare trustees recently released a report that showed sometime in the late 2020s, Medicare Part A is going to become insolvent. That is, the revenue that's being brought in for that program isn't going to be sufficient to cover the obligation in terms of reimbursement. On top of that, from a macroeconomic monetary perspective, the current interest rate environment has made the idea of easy money no longer sustainable. For example, the idea of being able to find low interest rates in order to finance debt acquisitions of digital healthcare companies or to hyperscale a digital health business is more challenged under the current environment. Beyond looking at macroeconomic factors, let's talk about reimbursement within the healthcare industry as well. With regard to Medicare, the key number to highlight is a year. It's 2030. In 2030, Medicare is projecting to have 100% of its beneficiaries in a care relationship with a provider that's subject to some form of at risk reimbursement. In other words, Medicare is looking to have, by 2030, all their beneficiaries in a care relationship with a provider that's involved in a value based contract. On the private industry side of things, employer sponsored health plans are increasingly focused on controlling costs and delivering better care to the lives that they cover for lower cost in order to create a more sustainable trajectory around the spend associated with those organizations and their healthcare obligations. All of these trends point in the direction of a movement towards value based care within the healthcare industry. Fortunately, the construct of the value based enterprise was put into place in order to facilitate providers entering into value based care contracts and relationships. And it's our contention that the value based enterprise construct is well suited to digital healthcare companies for success within value based care. So then that brings us to what is a value based enterprise? Essentially, a value based enterprise is a construct that was created both by the Centers for Medicare and Medicaid Services and the Office of Inspector General for the Health and Human Services Department. The construct was formed as both exceptions and safe harbors to the Stark Law and anti kickback statute that all healthcare provider organizations are responsible for adhering to. The value based enterprise exceptions and safe harbors essentially outline a business model construct that organizations can use to safely do things that previously were prohibited in the prior regulatory environment. For example, if you've structured your value based enterprise correctly, you can direct referrals on the part of healthcare physicians to utilization of specific services if in doing so you're doing something like advancing a value-based purpose like care coordination for the covered patient population. The value-based enterprise exceptions and safe harbors contain a lot of moving pieces, and we want to highlight a couple of those important components for you. The diagram that you see on your screen highlights the key takeaways that we'd like to communicate in this video for value-based enterprises. There's a lot more information to learn about value-based enterprises, and we've linked to those in the description to this video. As shown in the diagram, value-based enterprises come in three flavors, if you will. And those flavors correspond to the degree at which the reimbursement to the participants within the value based enterprise is at risk with payers. The first flavor of organization deals with enterprises that do not have any at risk reimbursement with payers for a given patient population. The second flavor corresponds to organizations that have taken on a degree of substantial and meaningful risk associated with the payers of a given patient population. And as you can see in the diagram, we've highlighted what the definition of substantial and meaningful risk is under the anti kickback statute, safe harbor, and Stark Law exception. Finally, the last flavor of value based enterprise is one for which the enterprise is fully at risk for all prospective patient costs associated with services to patients. Very few organizations meet that criteria, and therefore we'll focus on this video on the first two flavors of value based enterprise. The diagram here helpfully outlines the degree of at risk exposure necessary to meet the exception or safe harbor. In addition, it highlights some of the key flexibilities associated with meeting the exception or safe harbor. It's important to point out that by meeting these safe harbors and exceptions, organizations are able to attain very substantial flexibilities. For example, a lack of a prohibition on directed referrals, or no requirement to demonstrate fair market value associated with the transaction and the relationship between the parties. The final column highlights some of the key requirements associated with the value based enterprise within each flavor of value based enterprise organization. The key thing to keep in mind is that if an organization is not taking on risk with a payer, it is responsible for developing an outcome measure program for which the participants are held accountable and regularly measured against. From there, the flexibilities increase because if the organization takes on at risk reimbursement with the payer contract, the requirement to demonstrate outcome measures and adherence with those programs goes away. All in all, the value based enterprise exceptions and safe harbors enable very key important flexibilities for digital healthcare companies that will supercharge their ability to grow and deliver better care for patients. So now that we've introduced the value based enterprise concept, let's talk a little bit about why they make a lot of sense for digital health firms. First, the key premise behind the creation of the value based enterprise exceptions and safe harbors was to create a compliant way for healthcare organizations to share in success for value based care. That includes things like sharing and generating shared savings. And when we look at what it is that many digital health firms do, where the care that they provide happens, it happens oftentimes at the point of the patient, at the patient home, or handling some sort of care transition. And that's a point where the government and other players within the industry has identified a lot of excess cost and waste happens. So digital health firms are well suited to come to the table to organizations like health systems and make the case for sharing in the shared savings they're able to generate to that organization by providing a more hands-on experience with patients through the digital health technologies. In addition to that, digital health firms are often very patient focused, patient centered. And as we've heard a lot in this day and age, centering the patient at the in the care that's delivered is a primary focus of payers moving forward. And so we expect to see rewards tied to things like patient reports of their experience related to care. And digital health entities have a unique case to make for why they can succeed there. Finally, the last important point to make is that success in value based care is a proposition that requires a lot of integration and effective use of data. And the ability for digital health entities to generate continuous data from patients and take in other streams of data that they can then use to enhance the care that's provided to patients positions them to succeed within the context of value based care. Aside from how digital health firms deliver care, it's also important to note that digital health firms very often have a lot of experience working within capitated reimbursement models. That is, a reimbursement model whereby the entity receives a fixed payment per month per patient that care is delivered to. And I would highlight that capitated reimbursement payments meet the criteria for the at-risk component that's necessary to utilize the significant and meaningful risk safe harbors under the value-based enterprise construct. So, for all these reasons, the value-based enterprise business model is well suited to digital health firms. Let's now cover a couple examples of value based enterprise models that work well for digital health companies. Let's start with the digital healthcare company that's cardiology focused and particularly deals with patients post discharge from the hospital. Your organization might have had moderate success in billing independently on a fee for service basis for chronic care management and remote patient monitoring services. In addition, the hospital partners that you work with like what you do for them because one, they don't have to pay you, you're covering your costs through billing for fee for services revenue independently, and two, you help enhance the outcomes that their patients receive and the experience of care that they receive. However, that said, greater coordination between the two organizations would help foster stickiness between your organizations and potentially increase the amount of patients that you can see from that health system and potentially expand to other markets with that health system. So, how might a value based enterprise enhance the opportunities you have with those partners? Well, a care coordination value based enterprise doesn't require any sort of value based care reimbursement to be at risk. You can continue along your separate paths of the hospital billing and collecting for their services, and you billing and collecting for your remote patient monitoring and chronic care services on a fee for service basis. Instead, what a care coordination value based enterprise would allow would be for the health system to lease their staff to you as a digital healthcare company at a reduced expense in exchange for you demonstrating that you've improved the outcomes associated with the patient lives that you're covering. So, in this example, the hospital could lease care navigation staff that can help both entities achieve better outcomes with regard to patient readmissions to the hospitals, complications after discharge from the hospital, reducing mortality rates, and improving patient satisfaction rates. That care navigation staff, the hospital would be willing to share that staff with the digital healthcare company at a reduced cost because of the benefits that they receive to their reimbursement and value based purchasing programs through lower readmissions and better patient experience. For your organization, the care navigation staff that you receive from the health system can help improve the throughput of your clinical staff so that your providers are able to see more patients and utilizing the care navigation staff from the health system to facilitate the exchange of information between the two entities so that your providers can treat more patients and are not spending time tracking down that information. So essentially, this structure creates a win-win-win for patients, the health system, and your organization, while also allowing for a compliant sharing of resources where historically, if the hospital leased their staff to your organization, you would have had to have paid for 100% of the value of that leased staff to meet the historical exceptions and safe harbors to the anti-kickback statute and Stark law. Let's take a look at a second example of a value-based enterprise in the digital health space. In this case, we're talking about a telemedicine company that focuses on behavioral healthcare, in particular, patient consults between physicians and advanced practice professional staff and patients with mental health needs. In this example, our entity has been able to demonstrate that they've achieved success in reducing costly hospital admissions associated with patients that have mental health needs. Unfortunately, our company has had difficulty recruiting and retaining providers to deliver the professional medical services. The fixed hourly rate structure just isn't cutting it in order to keep providers within the organization. Well, in this case, our digital health company can consider forming a value based enterprise with the professional corporation that employs the medical staff that does the professional services consults. The value based enterprise can take advantage of the meaningful risk exception to the Stark law. In this case, the meaningful risk value based enterprise exception enables the organization to provide compensation to the providers in the form of doing things like sharing in the savings that the organization generates by avoiding admissions. By putting 10% of the compensation to their providers at risk, the professional corporation is then able to meet the threshold that enables that meaningful risk exception. In this case, in order to align the work that the providers are doing with the goals of the telemedicine business, the providers would receive a compensation package that enables them to earn additional compensation if they deliver on things like generating shared savings for the organization, while also maintaining patient experience metrics or doing things like improving health outcomes associated with patients. In this case, everybody wins because the patients receive better care through a more continuous healthcare staff. You don't have the same churn and turnover amongst the healthcare staff. The providers are able to earn additional compensation in the form of shared savings and quality bonuses. And the telemedicine business has a workforce that's aligned with achieving the goals that the payers have for that organization. We hope you found this video informative. If you have any questions about value based enterprises and how they can be used to take your digital health business to the next level, don't hesitate to reach out to us here at InHealth Advisors. Have a great day.